My name is Gail, and I started wearing readers when I was in my 40s, and then I had contact lenses, and then I had LASIK surgery, and it really was disappointing because it didn't last but a couple of years, and then I was back to readers again. And the story that I like to tell is that I was in the grocery store at the checkout counter, and I was trying to read something on a package, and the only way I could see the small print was to squint. And so I was trying to look at it, and this little boy behind me, he tugs on my shirt, and he says, "Lady, why are you doing this?" And I said, "Okay, that's enough of that." And then, of course, I found out that I couldn't do the cataract surgery with the lenses because I'd had the LASIK, and nobody ever told me that. So I saw Dr. Gulani. He did my close-up eye because I still have monovision. He did that 2 weeks ago, and I didn't realize that it was close-up because my right eye had been close-up before. And so a week later, my daughter texted me, and I was still in bed. And I'm writing back to her, and I realized I don't have glasses on, and I could never see the phone without my glasses. So I got really, really excited. And yesterday he did my distance eye, and I'm so glad that Dr. Gulani is here to take care of the special needs that some of us have. And I look forward to having the rest of my life where I don't make faces in the grocery store and
boys don't tell me.
yeah, people don't draw attention to my infirmities. But I love him. I call him Dr. Magic because just like TV and telephones and all that, I don't understand how they work. They're just magic. And I don't understand what he does. I'm sure to him it's very scientific. But to me, it is awesome magic. Okay?
It's a great story. Thank you.
Yeah. It's nice to see you all. And now I'm going to the heart doctor.
Well, we hope you have a successful visit. Yeah.
Thanks. It's just a checkup.
Oh, good.
Well, I'm Wayne Bogan, and I have severe stigmatism in both eyes. Through the years, I've met with doctors, and they all told me my stigmatism was so severe that there's no one that could possibly operate on me.
Not even to take out your cataract.
Not even to take out the cataracts. And my cataracts had got to the point I could not drive at night. I was no longer able to drive. And so I went to a doctor, and he in turn, this was head of surgery down in Charleston, and the gentleman checked my eyes and everything, and after doing all the tests, he said, "Mr. Bogan," says, "I'm sorry that there's no way that I can operate on you. Your stigmatism is entirely too severe."
Well, my name is Jack, and I had, of course, my cataract surgery on the first eye I've had treated yesterday. And like most of you, I have a long history of vision issues. I started wearing glasses in the second grade. My vision deteriorated tremendously. I had severe astigmatism, heavily nearsighted. Started wearing contact lenses in high school. Started with hard lenses, went to soft lenses, ultimately had LASIK surgery done on both eyes. Had a detached retina in my left eye. So you can see this long story of complicated visual issues. And then developed cataracts. And my regular eye doctor told me that, well, let's put off doing anything about cataracts as long as we can because you had this detached retina and you had LASIK, and it is going to be very risky and difficult for anyone to do anything to your eyes. So we did put it off for several years until the cataract got so bad that same situation you had. My night vision went down to nothing because the cataract was blocking all the light going in my eye, and I couldn't drive at night either. Same situation. And fortunately, I did have an eye doctor who knew about Dr. Gulani, because he had a relative that Dr. Gulani had treated. And he said, there's one person for you to go see, and that's Dr. Gulani. And of course, then that led to my surgery yesterday. But from the moment I first walked in the door here, I was impressed with just the reception that I was given. It was, everyone on the staff acted like, we're glad you're here. A lot of doctors I've been to see too over the years have not acted that way at all.
They
It's
don't
almost
even know
like
your
it's a-
name.
Don't know your name, and almost acted like it was an imposition that you were there.
And you wait half an hour to an hour to see them.
Yes,
Yeah.
and their life would be a lot better if they didn't have any patients to deal with. And then they didn't have time to actually deal with you as a human being. You know, it's just a very perfunctory kind of thing. So I have found Dr. Gulani to take a very personal interest and very, very professional, and the results are really incredible.
You can't even tell that you had eye surgery yesterday,
No.
which is amazing for all of you.
Yeah.
I'd like to preface the next speaker by saying that I was brought up here 8 years ago by a friend of ours who doesn't trust anybody, especially around her eyes. And she was so amazed with what Dr. Gulani had done for her that she practically dragged me up here and said, "You've got to see him." And he did the laser surgery on my eyes, and I have not had any trouble seeing since then. So when my wife started developing cataracts, I said, "You got to go see him and take it away."
Well, I was basically told that they could do the LASIK, but I would probably still have to wear glasses. And I had a very severe astigmatism and also very myopic. And Dr. Gulani, this is day one after my surgery of my second eye, and I can see perfectly. And I'm so thrilled. My life is going to change immensely. I will no longer have to pat around on a tabletop looking for my glasses when I take them off, because I don't need them anymore. So this is fantastic. It's very liberating.
It's amazing.
Yeah, it is.
It is amazing.
Yeah.
Well, I'm Nancy, and I've had poor vision all my life. And when I was about, I think about 13, the optometrist diagnosed me with a lazy eye or amblyopia. So that's what I believed almost all of my life, until I decided to try and have laser surgery to see if that might help things. And when I went in for that appointment, I found out that I had a condition called keratoconus, which just means that the eye,
Same thing he
the
said.
cornea is pointed instead of curved, and in my case is more like the Alps in shape. So it wasn't that I had a lazy eye, I just had such poor vision that the eye was pretty much useless. I was living in Los Angeles a few years ago and went to one of the world-renowned surgeons there who recommended that I have 5 different procedures, each of which would cost $5,000. And he was very surprised when I opted only to do one of those procedures to see how it went. That procedure was to have a little strip of plastic put in called Intax. And he did that. He was very pleased with the results because the topography of that eye had lessened, had gotten a little less sharp, but my vision was no better whatsoever. So in his eyes, the metrics showed that it had been successful. But in my eyes,
You couldn't see.
it was I had just thrown away the money because it wasn't any better. But when I found out that someone in Florida, I had moved here about a year ago, and found out that someone in Florida specialized in keratoconus, so I just came here to have a checkup, see what he thought, and he immediately said, "I can help you. You have a cataract, by the way, and that's kind of irrelevant, but
I can, when I fix your cataract, I can improve your vision tremendously, which is the first time I ever heard anyone say they could improve my vision that much. So I'm very happy one day after surgery to be feeling pretty good.
That's where the cookie cutter stuff comes in.
Exactly.
Because they won't do it.
By the way, I didn't say my name is Mark and my wife is Joanne.
They won't do it if it's not within that parameter. But he will. And I'm glad of it.
My name is Kathy, and I'm from Jacksonville. I had vision problems all my life, or pretty much since at least I was 10 years old, I'd say. Something 4th grade, I started wearing glasses, and had really bad astigmatism. Went to contact lenses at about 16, and dealt with that hard contacts, and the eyes got a little irritated from that. Went to soft ones, couldn't really see with them.
No.
Yeah, I had real problems with the soft ones. I couldn't fill them up when nobody believed me. But anyway, then went to the gas permeable ones, and then about 18 years ago, I had watched the whole LASIK type of thing, and decided this is what I wanted to do. So I went to a reputable surgeon locally and had LASIK done in both eyes, and the astigmatism was so great that my eyes said, forget it, and just reverted back.
Oh, God.
And he was very concerned about that. He said, you know, you're a problem for me. Let's redo it. And so he redid one eye, and vision was just outstanding in that eye for 3 days.
Oh,
It reverted back, and I'm
How
going to tell you, that was so
disappointing. Yeah.
traumatic to me.
She was in tears. I mean, just to have
Really?
perfect vision and just go away.
So I said, no, no more, forget this. And then
Did you have to go back to glasses or contacts?
contacts, yeah. And then about 3 or 4 years ago, we had an orange tree, and we had a freeze coming through. So I went out in the yard to pick oranges out of the tree, and one of the limbs snapped, hit my eye, and actually put a hole in my contact lens.
Oh my
Oh,
God.
my goodness.
Yeah.
Wow.
So, and I didn't realize it, but there was a noticeable scar there that Dr. Gulani picked up on right away. But
She had seen another doctor earlier, and some friends of ours who had been to Dr. Gulani said, you really need to see him. And so we went to Dr. Gulani for a second opinion, and he's telling us stuff that the other guy just didn't see, or didn't tell us about it. He did.
well, and our feeling is Dr. Gulani treats the patient, not the problem. Well, plus the problem, but the patient comes first.
Yeah.
And, you know, he's very passionate about what he does. He's a perfectionist, and trust me, with my eyes, I really
You want a
appreciate that.
perfectionist.
That's absolutely.
Everybody does. I agree.
So,
Because when I get something wrong with mine, I'm coming here.
you know, I would have never known about him except for 2 friends of mine had come here for different problems, and they were both very pleased. And the one gal said, and she's a person who researches everything before she does it, and she said, you have to go to him for a second opinion. Because I just didn't feel comfortable. The first doctor, I thought, you know, you've got so much going on. I just feel like I'm kind of like, okay, down the straight and narrow, but nothing special. So anyway, 5 minutes into the office here, and we were like, this is my
He's our
doctor.
guy.
So,
Hey guys, everybody, you're chatting behind my back again.
Conspiring.
All of you, please
We're
remember
setting you
again.
up, you just don't know it yet.
So all of you are day 1 after surgery, please be careful. Protect your eyes, get your drops going, and then travel safely back home. And been a real honor. That's
all right.
Nancy, pleasure. John, enjoy it. Thanks for the candies.
Oh, you're welcome.
Jack, absolute pleasure. Absolutely. Absolutely.
We'll see you tomorrow.
We will.
I'm gonna have something designed.
Thank you so much.
I was just going to say this is a 180-mile round trip for us, and we've made it 3 times this week, and I don't regret an inch of it.
That's
Great guys, thank
But
you
he
so
couldn't
much.
wait. He couldn't wait to get back down here. This, I
of course.
I had to go get I had a doctor's appointment, and he was wanting to hurry this thing up so he could get back and do this other eye.
Yeah.
He's from Carolina, so
Yeah.
absolute pleasure. Come guys, come